Thank you. Good evening. Today is December 7th, and I'd like to call to order the Board of Health meeting for Shrewsbury. First on the agenda is to approve the minutes for the November 9th Board of Health meeting. Do I have a motion to approve?
Motion to approve?
Do I have a second?
Second.
Thank you. Dr. Abraham?
Aye.
Aye.
So approved. Next on the agenda is to review and discuss the coronavirus COVID-19 updates.
I will ask my colleague, Ms. Amelia Halton, Chief of Public Health Nursing, to give an update.
So, we don't really get many cases reported anymore. They're pretty low. And as we all know, it's because when you take a home test, it's not obviously sent over to the state, and it can't be tracked. So the numbers are probably a lot higher than we think. So there really isn't much to report in terms of the case investigation. In terms of COVID-19, there haven't been any recent clusters either that have been reported to us. There's really not much on the case investigation front. Other than that, we've had some tick-borne infections come up for some of the towns, but now it's a lot colder, so maybe that will kind of die off. And that's really it from a communicable disease standpoint. Vaccine-wise, I have COVID and I have flu vaccine for the uninsured. So that's where we're at. And we do have COVID tests. I don't know if Shrewsbury needs any, but we do have COVID tests.
No, we're all set right now.
Okay.
Thank you.
Thank you. That's really it in terms of the coronavirus COVID-19 update and communicable disease case investigations.
Thank you. I did see that email that came across around an uptick in Hep A.
Mm-hmm.
Are we seeing that in the Worcester area?
It's the cases haven't come through. They're in Massachusetts, but they haven't come through our Maven system, our virtual system, as reported in Worcester or Shrewsbury or any of our alliance towns. So at this point in time, we don't have any.
Okay.
They're around, but we don't have any.
All right. Good to know.
So,
Thank you. Dr. Abraham, do you have anything to add around the COVID front or flu?
Yes, thank you, Madam Chair. So hospitals are seeing an increase in cases quite significantly. We have 32 plus cases and climbing pretty rapidly. As expected, the holidays are always a potential source of clusters of infection because of gatherings which are unmasked, and no surprises 2 weeks after the holidays, and we are started seeing the explosion, and this will obviously continue to climb as we get into further holiday gatherings in the next couple of weeks or so. There are variants, about 10% of a variant called the BA.2.86, which is considered a variant of concern now. It was a variant of interest, so it's increased, but again, part of the Omicron family, but the subfamily. And there's a new one called JN.1, which is currently in very small portions. Elsewhere in the world, it's a larger amount, but not in the US as yet. The current vaccine works well against the Omicron family lineage. We have not seen any breakthroughs through that yet. So the vaccine still works, but unfortunately adoption is singularly low. Anecdotally, a number of our patients opt to get the flu vaccine, but for some reason decline to get a COVID booster, which is a bit of a head scratcher, but be that as it may, so we suspect there's pretty low adoption of vaccine this year. And so to be seen, I think lots of people across varying age groups who are getting sick, unfortunately, because of that. Other flu activity is only about 0.5%, so relatively low right now. Again, could be reflective of the fact that people stay at home and don't really come in a hospital or get tested for flu and get diagnosed. And that's probably the more plausible reasons given the similar spread as COVID. And so they're both airborne infections. They should mirror each other in terms of spread numbers, but flu is relatively low. It also could reflect the fact that more people get the flu vaccine and less people have taken the COVID vaccine. And so there's probably more protection. It's the influenza A strain, which is currently in circulation and well covered in the vaccine. So we anticipate that at least flu will be relatively milder, at least for now. So we continue to encourage masking, hand washing, distancing, and all the rest of it. But as always, I think gatherings are a potential risk factor, and that continues to exist.
Great, thank you.
Dr. Abraham, a quick question. Are you seeing a lot of RSV at the hospital in the elderly population?
Not too much. Good question. Recall, even nationally, the RSV numbers are small, not singularly large. And even here, we have sporadic cases, but not as many. Now, granted that the 60 and older population, a fair number have gotten the RSV vaccine and are genuinely interested in getting it. And so we encourage all grandparents of newborns should get it, because normally the newborns are immunized with an RSV vaccine, but there has been a significant shortage of that vaccine and availability. So the babies get it in the first day or two of life when they're in the nursery, but that's been a bit of a challenge. So I think having their parents and grandparents, or at least grandparents, definitely immunized helps to decrease the risk of spread both ways. But yes, some cases, not an overwhelming amount. COVID is by and large our largest phenomenon.
Great, thank you.
Thank you very much. I just want to circle back with something from the last meeting. I think, Amelia, you were talking about trying to get some clarity from SMOC around the new arrival population at the Days Inn and vaccination. I'm wondering if you had any luck with that.
I had a meeting with Noel Freeman, the director of nursing for the schools here in Shrewsbury, and we met with some people from the state on a Zoom call. Mm-hmm. And we're actually in the process of going back and forth via email on figuring out what's needed. Mm-hmm. It seems like the students are vaccinated and they are getting what they need. We're just having a tough time getting access to the records or the information from the records. So from what we understand, there isn't anything urgent that we need to do, but we're working with the state. It's just a little bit of a back and forth.
Yeah, yeah. All right, great.
So, yeah.
Good. Thank you. All right, moving up. Next topic is review and discuss updates from the Central Mass Regional Public Health Alliance.
Thank you to the chair. I'll ask my colleague, Ms. Emma, to give an update on the inspection, environmental inspection of work in the town. Emma?
Thank you. So since last meeting, I've done 51 total inspections. This is including complaints that might come in, re-inspections that are required, and staying on top of the routine inspections for our food establishments. This number also includes the temporary events that happen in town that do require permits the day of as well.
Great, thank you.
I think Dr. Abraham have a question for you.
Yes. Thank you, Solo. Please go ahead.
No, I think Dr. Abraham, you want to talk about the incident at Emma. Can you give an update on the incident at the restaurant regarding the rat, please?
Yes, thank you so much. You read my mind.
You're welcome.
So there was a complaint received a few months ago, I want to say back in July, for the same issue. The complaint was unfounded at the time by the inspector. I did follow up on the complaint that was received, and I did a full routine inspection. While there was no live activity that was noted. There were, there's evidence of activity in the establishment. I provided some education for the general manager that I kind of toward the establishment with. We went over previous invoices from pest control. I wanted to see how often pest control is coming, what their recommendations are, what they're finding during their visits. I advised to clean up any droppings to better monitor the situation. This is not something that's going to be cleared overnight, so I wanted to see an increase in the frequency of exterminations by the licensed pest control company. And I will need to revisit it, but I need to allow some time for those treatments to be effective.
And was it determined which variety of rodent it was?
No,
Okay.
We like to see activity. That's how we kind of identify if there's anything going on. The specifics and the types, you know, we leave that to the licensed professionals that treat it. If most establishments do have contracts with pest control companies and they do treat regularly, it's just a matter of maybe following the advice. A lot of companies will point out sanitation issues, or they'll point out holes or ports of entry that they're finding. So I just remind our restaurant managers and people in charge that it is important and imperative to follow those guidelines and suggestions, because it's going to help eliminate the problem or better manage the problem.
So when you go back to do your re-inspection, will you be able to see the actual reports from pest control? Are they required to provide that to you, or just say that they've done it?
So in a situation like this, I would request that I see them. If I go to an establishment and I'm not seeing any activity, it's more conversational. But in a case like this where there is visible activity, I do request to see the most recent reports. Like I said, I want to know what they're recommending, what they're finding when they go a little bit more in depth, and what their treatment recommendations and requirements are. And then from there, I can see we need to do more, we need to do less, we need to, you know, clean the areas so we can better see and better gauge how significant the problem is.
And
When they
Emma,
have-
your evaluation, you didn't find any food hygiene issues, correct?
No, it was relatively, there were minor things that were able to be corrected on site. There was no significant major health concerns at the time of the inspection.
Got it.
All right, thank you very much. All right, any other items before we move on to the schedule?
To the chair, I would like to recognize my colleague, Ms. Karina Scott. Karina Scott is the coordinator for the shared service coordinator with the Alliance Town. Karina, you have any updates?
Forgive me with my voice. No real big update, just that we have met with the new arrival task force in Shrewsbury. We are part of that conversation. What I can report from that is that all the children so far have coats for the winter.
Great.
I think there are a couple adults that is still questionable, but we have an avenue to get them coats. In terms of the holidays, it seems that they're all set. There are some questions about a holiday party that they might be hosting, but we're taking care of that, and Emma is assisting with that as well.
Excellent. And I saw that there is an effort in town to hold a new holiday event
Yes.
with them. That's great. What about socks and shoes? Because I know many of the new arrivals arrive flip-flops, Crocs, those types of things.
Yep, snow boots was addressed as well. I believe they have that solution. The schools where most of the children in need are located, they're going to have borrowed gloves in case they forget it or they don't have it. They can just put on the gloves for recess and take them off. And if it becomes a continuous issue, then gloves will be provided to those children. And then shoes, they're all set.
Great. And the adult population as well?
I believe so, yes.
Okay, excellent.
It's great news.
Yeah, and then I believe eventually there is an interest, and it will be happening, to create a hoarding task force to address hoarding in Shrewsbury. We don't have a date when that will start, but it's something that we have the group of people who will be part of it. So
Excellent. Excellent. Thank you.
you're welcome.
Thank you. Anything else?
No, I think we're set. Thank you, Madam Chair.
All right. Well, let's review the meeting schedule. I think we may have identified January 17th
At 6 p.m.
at 6 p.m.
Yes.
Great. Excellent. Thank you, Carrie.
You?
Do I have a motion to adjourn?
So moved.
Second?
Thank you. Dr. Abraham?
Aye.
Karen?
Aye.
Thank you. And Jenny? Aye. We're all set. Thank you.
Thank you.
Thank you.
Wishing everyone a good holiday season.